Okay, well, good evening, everyone. It's nice to see you all. We're going to go ahead and call to order the Committee of the Whole. And for the record, it's Monday, March 8th. We have two items on our agenda tonight, and we get to start out with an important introduction. I see our Chief Heitman has joined us, so we're going to start by introducing Chief Steve Heitman to Council. And I haven't really prepared anything, so I think I'd just like to turn it over to you, Chief, and just invite you to say hi and introduce yourself.
Thank you. Good evening, everyone. Thank you for having me here tonight. For those of you who don't know me, my name is Steve Heitman, and I'm the new Fire Chief for the Renton Regional Fire Authority. I come to you by way of the Mercer Island Fire Department, where I was the fire chief for the last little over 6 years, and the deputy chief there 7 years prior to that. Throughout those years, I've been fortunate to garner a lot of experience in a chief officer role, and I also placed a high emphasis on education. So with that, I've earned a master's degree from the Center for Homeland Defense and Security at the Naval Postgraduate School, my executive fire officer certification through the National Fire Academy, and my chief fire officer certification, which is an accreditation factor through the Center for Public Safety Excellence. I am very honored and excited to be the fire chief of the Renton Regional Fire Authority and a part of the Renton community. My family and I live in the area and have shopped, dined, and played in Renton for many years. This is an outstanding organization that I am now a part of, and it is my goal to make it even better. We're committed to serving the community with the highest level of professionalism and integrity, and this includes providing services outside of our normal scope, which currently includes mobile vaccinations, which is a very hot topic. As you can imagine, the logistics of this effort is one of our biggest challenges, but we've been able to partner with the City of Renton to accomplish this difficult task. Deputy Chief Chuck DeSmith had the foresight to partner with Mary Jane Van Cleve, who's been brilliant in planning when and where we need to deliver these vaccines. I'd like to share with you tonight that they are both on the call or the line here so that Mary Jane can do a presentation as to what we've accomplished so far. And then also Deputy Chief DeSmith is here to answer any questions that may go a little bit further than my knowledge base at this point. Thank you again for having me and meeting tonight, and I look forward to working with all of you in the future.
Okay. You know, I should point out that several of us are currently on the Renton Regional Fire Authority Board, as is typical, 3 council members. So I'm on the board currently along with council members Perez and McIrvin. And we were part of the search, and actually I think others of you got to have inputs, but it's worth noting that we really did a national search. We looked at local candidates and national candidates as well. And we're just very fortunate to find somebody with the experience that Steve brings locally. But it was a good search, great candidates, actually, many excellent candidates that were looked at in that job. So we feel very fortunate that we're able to bring you aboard. With that, do any council members have questions for Steve? Okay, well, perfect time. You kind of helped us segue to our second item, the mobile vaccinations in coordination with the Recreation and Neighborhood Division. And then did I understand maybe Mary Jane, you'll help us with that? Or?
Yes. All right. Well, thank you. Good evening, Council President and council members. Thank you again to Chief Heitman. He's been wonderful to work with, and everyone with the Regional Fire Authority. Not present and maybe joining us later is Chief Hicks with Keene County Fire District number 20. Currently, they are a very active partner in supporting our consolidated effort. I'm going to share my screen for a moment just to go over a few slides, and then certainly answer any questions that you all may have. Just give me 1 second. Gosh, I'm getting really good at Teams, and now I feel like I forgot how to use Zoom, but I'm going to get there. I apologize. All right, here we go, right? It's like the dilemma of technology.
We will all be experts right around the time the pandemic's over.
Right, just in time. So I apologize. Okay, so this is a trifecta brought together project. This is certainly spearheaded by the Regional Fire Authority. We are certainly on board as a supportive unit. They are an extension of King County Public Health with a specific strategic plan on addressing a targeted population, and I'll share that in a moment. So we just definitely want to acknowledge our King County Fire District 20 partners in this effort. This is currently, so King County is doing a fantastic job, as best they can, I should say, because there's a lot of incoming information at the moment. So there is a website, I referenced it below, and I apologize, I just got this presentation over to Judith. King County has a host of data and metrics. All the data that we are collecting from this project is being fed into these maps, and so I just wanted to use this for reference. We're also being referenced in a regional sense, so sometimes we be consolidated and bulked up with our partners with Burien, Renton, Tukwila, and SeaTac. So just for reference, that's how King County is kind of consolidating our particular region at the moment. They're still looking a little low. We're at 19%, but again, they're going as low as age 16 for the current rollout of vaccinations. So to identify and just articulate these specific strategies, there's private providers, practices, and pharmacies. There's also currently a federal pharmacy program, and that is being coordinated by the Department of Health and King County. Several of the adult family homes in our region are being taken care of through this partnership, and it's a multitude of them, and it's a little bit slow moving. It's federally obviously coordinated and the state coordinated, so it's slowly making its way out. We recently were told that some of these locations were not captured in that federal program, and so RFA and King County Fire District 20 will be seeking out and visiting those specific locations. Where we fall in terms of this effort that is currently underway by King County and the state is under that mobile clinic. So there's mass vaccinations right now, there's mobile clinics, which is where this program falls or project, and then there's another group that's dedicated to pop-up community clinics, and that one of the main ones is faith-based organizations. They believe working with these groups are going to get some targeted demographics and folks that are not going to be captured in some of these senior living locations. The focus with the particular strategy that this team is responsible for is those seniors that may have mobility issues or challenges and also live in congregate living. So that's why we were given a specific list from King County Public Health where it's adult living, it's income-based restricted living, and it's adult family homes. So this is where we kind of fall in line. In terms of our trifecta effort, the City of Renton is stepping up, and we certainly had no hesitation at saying yes to supporting the RFA. We know how much seniors are a priority to council and continues to be a priority. So the recreation team is essentially administering the coordination of the location. That requires us to contact them, ask if they're interested, and a specific amount of paperwork needs to be filled out in advance. There's a portal. Some can use it, some don't. So we never want technology to be a barrier of any sort. So we will administrate that support for them. We're also working with emergency management to use Code Red. We're in the process for surplus. In the instance there are surpluses, and there is at moments, that we are creating a senior list of folks in the community that we can be contacted via Code Red, and they are able to come and take advantage of these. So we don't want any vaccines going to waste. The RFA has been really diligent about that. And so we are creating that separate list to make sure after our priority list of folks and locations are served, that if there's surplus, other seniors can take advantage as well. They're also 65. We have certainly heard a lot from seniors that some of them just don't understand how to navigate the website. They're having difficulty understanding where to go, and even for myself, it's a little confusing. So we are not hesitating to taking down their name and information and trying to capture them and get them where we can. We're also working with the GIS mapping team, and that's Aaron Raymond and Jillian Edge, to really make sure we're understanding the public health data. We're using public data because we can't currently use data that we're giving to King County since that is protected by HIPAA. And I didn't give a big shout out to my team, Elaine Rosak, Carrie Nass, Zach Holmes, Jeannie Gabriel. These guys are working really hard to make sure we're in compliance and supporting. Then down below, so fire does the other heavy lift. They are then, once everything's coordinated, they are picking up those vaccines, they're verifying the paperwork. Lieutenant Sowers and Captain Wyckoff are amazing. They're doing site visits if necessary. So they really want to take advantage of their time and make sure it's done safely. So they coordinate how will they administer these shots. They can go up to 100 in one day. That's providing King County's mobile unit and the RFA mobile unit are working together, and then they break out into groups. So they really are done this in a very methodical manner. So sometimes it does require a walkthrough. Then there's an immense amount of post paperwork along with the site visit that they have to do, and they provide that back to King County. So there's a lot of details and loose ends and moving parts, but I feel that as a team, collectively, everyone's working together really wonderfully. This is just some demographics. There was a 2016 health report conducted by King County Public Health, and this was Renton. So this is just, unfortunately, this isn't the updated census information, but 11.6% of the population is what we're looking at in terms of volume. That's the number of seniors over 65. And so that just give that context. We don't have data yet on how many years we're effectively hitting, but I'll show you in a second a map that we're working on. And it's not for public use. It's going to be an internal tool to report out and to make sure there's no geographic gaps in services once we are fully completed in supporting this specific strategy. So here's an example of this map, and I'm going to, hopefully this isn't in the way. What we're currently mapping is the adult family homes. We are mapping out senior living facilities. We're mapping out low-income senior housing and adult family homes. We're also capturing our city limits, our planning areas, but we're also looking at a heat map based on the poverty lens. What that is it's just the federal poverty line doubled, and that's essentially our working poor. So we're really trying to make sure that as we go and we're executing this specific strategy designated by King County Public Health, that are there any potential gaps, and what could we collectively do between our fire authorities, our city, and partnership with public health. We're aware of the faith-based organizations, so we have an ask into King County Public Health, and we're asking them what churches will be popping up vaccinations, so then we can also map that and just start to continue to get that visualization. We are supporting West Hill and Fairwood, and so collectively, that's why those areas are included in this particular map. So that's it for specifically just the visual sharing. I'd be happy to answer any questions in terms of just, we're also very much in our infancy. Last week was the first full week of completion. Vaccines are occurring Monday, Wednesdays, and Fridays, and that, so we're really, really early in terms of this effort. So we'd be more than happy to come back as we kind of collect more data and more experience and more information, but I can help and try to answer what I can right now.
Well, a great presentation. I sure appreciate everybody that's doing this right now and working on it. And I know that it's been a little bit throttled by the amount of vaccine, but I also just from the national news we're seeing, I'm pretty confident that the supply will start increasing. So I suspect it's going to be really, really valuable that you're all contributing to vaccinating people as the levels of vaccine start growing. Council, any questions from any council members? Comments? Okay, it probably means you touched on everything very well. So, great job.
If I could just say a couple of words, being new, I am very, very impressed with how well the partnership has come together and how well the RFA and the city are working together, and just the synergistic effect that has had on this process. As I said, the logistics is really the heavy lift in this. We've got the people to get the vaccine out. It's finding the patients where they are and organizing this. And so I am just very impressed once again with the move that I have made and the partnerships and the relationships that are already built. Everybody has been wonderful to work with, and I just see great things happening, and that's what's needed right now. And so I'm just proud to be a part of this.
Well, that's really, really kind, Chief Heitman, and means a lot. And it is consistent with my observations of both the fire department and our city staff and the kinds of work they do together. So thank you for that.
But
all right. Well, I think that concludes the committee of the whole for tonight. Short meeting tonight, but we'll reconvene as a full council at 7 o'clock in about 40. Mr. McGurven, Councilmember McGurven.
I was only raising my hand because I see that Councilmember Perez and Councilmember Benedetti have their virtual hands.
Thank you for pointing that out. I appreciate that. And I don't know who was first. I'll go to Councilmember Benedetti.
Actually, I think Councilmember Perez was first.
Oh, okay.
Either way, it doesn't matter. Thank you, Mr. President. Just once again, Chief, to welcome you. Thank you for everything. It has been a delight to work with you in the last month. So very, very happy that you joined the RFA. And Mary Jane, once again, the reason why I haven't answered questions is because you have done such a good job answering all our questions during Community Service Committee, and I very much appreciate this partnership. I think it's going to be very helpful for our most vulnerable community, and I'm very happy to know that we're going to be bringing the vaccines to them, and I think they are going to be very happy with this result. So thank you again for the partnership and the collaboration.
Thank you, Councilmember.
Councilmember Benedetti.
Thank you. First of all, Chief Heitman, it is such a pleasure to welcome you. I know that you are coming to an incredible place, and so it's good to know that you recognize it and that you're willing and able to jump right in. So thank you so much for coming and joining the team. So Mary Jane, I do want to echo Councilmember Perez's comments that this was a very thorough presentation. I just had a question. Once, presumably there will come a point where we have really made an effort and managed to get the overwhelming majority of our senior population inoculated. At that point, will the efforts be turning to other populations that are eligible for the vaccine? And if so, have you thought that far down the road?
We have, but our goal at the moment is to make sure no seniors are currently left behind. And unfortunately, this strategy is really focused on those that are immobile. So we've gone even further than what King County has provided us to make sure all our rent and locations. So we have some mobile homes that have been mapped through our housing repair program. We have seniors that also still live in their homes that are income strapped and just are completely unaware and how to navigate the system. So we do foresee the senior population being a priority for quite some time. We also have some language barrier issues and trust with the system, and so we're working with some partners on the sideline. We're waiting to see what they're able to do and letting them know about this effort. And so I think as we comb through all of this, I think we'll probably reconnect with the RFA in King County and Public Health to figure out where we are in those extended eligibility lists. But we're hoping to move in parallel as much as possible. And it's challenging for so many seniors right now. So our time and efforts are definitely going to good use, but it'll be interesting to see how long it takes just to get this population vaccinated at the moment. But you're right, we do and are prepared, but we're trying to make sure no one is left behind in any way. So that alone is kind of time consuming at the moment, but we'll definitely come back to council once we feel we're really confidently have captured most all of our seniors in the community before we move forward onto a next demographic.
Thank you so much, Mary Jane.
Thank you.
Great comments, and thank you again, Councilmember McGurven, for pointing out the hands raised. Okay, well, with that, I'll go ahead and adjourn the meeting, and I'll see everybody in 40 minutes at the regular council meeting. Thank you.
Thank you, everyone. Have a wonderful night. Stay safe.